So the first thing I'm going to do is I'm going to assess the 5 rights on the MAR and the chart. So the first one is the right patient, which is Jaguar Jones. The right medication, morphine sulfate, the right dose, 5 milligrams. The right route, IM, intramuscular, every 4 hours as needed for pain, which is right time, and then every 4 hours as needed for pain. And the next thing I'm going to do is assess allergies. So the allergies on the MAR is penicillin, and the allergies on the chart is penicillin. The next thing I'm going to do is I'm going to perform hand hygiene. And then I'm going to choose the correct medication. So the correct medication would be morphine sulfate, and then that's given at 10 milligrams per milliliter. And the dose is 5 milligrams, so I would give half a milliliter as the dose. And the next thing I'm going to do is I'm going to clean the vial. And I'm going to get my syringe and my needleless system ready. I'm using a 3 milliliter needle. Oh. And then I'm going to draw up my dose in air. And I'm going to inject it into the vial. And I'm going to withdraw more than the dose at first, and then get rid of any large air bubbles. Okay, there we go. I'm going to inject back into the vial until I get my correct dose. And then that is half a milliliter. I had to redraw my lines because they rubbed off. Okay, next I'm going to use the scoop mechanism to dispose of my needleless system. In my sharps container. And next I'm going to use sterile technique when putting on my needle. And so now I have my syringe ready. Now I'm going to check for the 5 rights again. So the first thing I'm going to look for is right patient on the MAR, and that's Jaguar Jones. And then I'm going to look at the vial, morphine sulfate, 5 milligrams, and this says 10 milligrams per milliliter, so I would give half a milliliter, and then that would be given intramuscularly every 4 hours as needed for pain. And now I have a label prepared for the syringe, and it has the patient name, Jaguar Jones, and it has the medication name, morphine sulfate, and it has the dose, which is 5 milligrams, and the amount I'm giving, which is half a milliliter. I'm going to attach that to the syringe. And now I'm going to go to the patient's room with the MAR, my gloves, sanitation wipes, and the syringe. So the first thing I'm going to do is I'm going to perform hand hygiene. And next I'm going to look at 2 patient identifiers. So I'm going to be looking at the armband and comparing it to the MAR. So first thing I'm going to look at is the patient name, Jaguar Jones, and then I'm going to compare the medical record numbers. So that's going to be 417-6352, 417-6352. And then next I'm going to state the 5 rights again. So I'm going to be giving this medication to Jaguar Jones. I'm going to be giving the medication morphine sulfate, the dose of 5 milligrams intramuscularly, and it's going to be every 4 hours as needed for pain, and it's been several hours since he has received his medication. Also, I'm going to look at the allergy band, and he's allergic to penicillin. And what kind of reactions do you get from penicillin?
Knives.
Okay, so today we're not going to be giving you any penicillin, so you shouldn't have any problems.
Okay.
And now I would explain the procedure to the patient. So I'll be administering morphine sulfate to you, and that's going to go into your hip. And I'm going to tell you before I give it to you, it's just going to be a little stick. Next, I'm going to lower the bed rails and raise the bed to a working height. And now I'm going to apply clean gloves. So now I'm going to clean the area of the ventrogluteal area. And I'm going to leave the sanitation wipe pointing to the area that I already cleaned. Now I'm going to uncap the needle. And I'm going to pull the skin. And I'm going to inject. I'm going to aspirate for any blood return. And now I'm going to slowly inject the medication. And I'm going to get rid of the needle into the sharps container. And I am going to cover the patient back up and remove my gloves. And I would lower the bed, and I would raise the side rail back up. And then I would document the patient's reaction to the medication and see if they had any allergic reactions, and documentation would be the 6th right.